So Sam is the Senior Programme Manager for Green Social Prescribing. Obviously, you are heading up this national programme for green prescribing, and I just love, if you could, wonderful if you'd really outline, give an overview and the aims of the programme, that would be really helpful.
Yeah, thanks very much, Olivia, and it's lovely to be here today, so thank you. The Green Social Prescribing programme is a really exciting cross-government initiative, and it's looking at how we increase the use and connectivity to the natural environment through green and blue social prescribing referrals. And we're really looking at how we might scale that up. It's really exciting in that we're working across government departments, so we're working with partners including DEFRA, NHS England, obviously ourselves, Sport England, Natural England, Public Health England, and the National Academy of Social Prescribing, along with our local integrated care systems and the expertise there. So it brings together a great range of expertise across what we're trying to do. And it really gives us that opportunity to put into practice and test out some of the objectives of different national policies. So, for example, some of the objectives of the NHS long-term plan that Nick mentioned, and the 25-year environmental plan. So it's a two-year programme, Olivia,
2 years,
and there's lots of evidence already that suggests that engagement with the natural environment, and other speakers have mentioned this, leads to a range of health benefits. And obviously during the pandemic, lots of people have found that spending time in nature has helped them to cope with lockdown. Our programme is specifically focused around tackling and preventing mental ill health by referral to green or blue social prescribing.
Right, okay, yes, because of course, it could benefit physical health as well. I think Jenny's project saying, but this project is focused on mental health. That's really useful to know. Thank you. So I remember you saying to me that there are 7 pilot sites which are sort of spread throughout the UK to kind of learn from each of those places, really help with the scale up. What I know that each site is doing something slightly different, but what sort of common threads and themes run through the projects in each of those places? Sam, I'd love to hear more about that.
Yeah, absolutely. So it's really interesting because they're all working in communities that have been very hard hit by COVID. They're all working in communities where there's a high level of health inequalities across those communities.
Yes.
They're all taking a strategic approach, and they're working with a whole wide range of different people and different sectors to test how to embed and scale green social prescribing. So, for example, the local leadership teams are made up of people with lived experience, green and VCSE sector providers, social prescribing link workers, and other health and social care practitioners and commissioners. And then things like collaboration and co-design, there it's sort of like the golden threads that run throughout this programme, and it's really important to, absolutely, to make sure that these services are delivered in a way that makes sense to local people, and so referrers are also confident in using them. And then finally, they're all working across the continuum of mental health need.
Right.
So working from early prevention to working with people with more moderate mental health need, right through to people who might be in recovery.
Great. Okay, that's great breadth, but some wonderful themes running through each of those. Sort of co-design, the cross-sector collaboration, capacity building, and systems, create the right systems, the right conditions for systems change. Yeah, wonderful. Thank you, Sam.
Absolutely.
So we've mentioned the things that hold them together, but obviously there is a diversity of approaches. And what do you think is important about that, really, about the diversity of those different approaches?
Yeah, I think that the diversity is really important because it means that if we can find ways to scale in lots of different contexts, then it's going to enable us to roll this out more easily in the future. And some of the differences are that they're working in different communities. So we have a mix of kind of urban, rural and coastal communities, for example. And also the relationship between health sector and voluntary sector partners varies in different areas. So in some areas we have the voluntary sector who have been commissioned to actually lead and deliver, programme manage the whole approach, and in other areas they're involved in specific activities like community engagement and working to support the green sector.
Great. Okay, that sounds like a very rich mix there, which will really help in a scale up. Yeah, fantastic. So last of all, I have a quick question about funding, which is the thorny question, isn't it? Because obviously we've heard before about sort of people feeling need that if people are going to change, they need that long-term commitment and they need the funding to go with that. So what are your thoughts on that?
Okay, so it's a tricky question, isn't it? So this is a funded programme over the course of 2 years. We view this money as kind of pump priming money, so it is short-term money, but it's there to kind of oil the wheels. It enables people to have the time to do that very deep sort of engagement and cross-sector sort of collaboration. And importantly, it will fund some green and blue social prescribing activities, interventions. And then part of what the test and learn sites, the pilot sites that we're working with will be investigating is opportunities to embed this, to fund it and make it sort of ensure that it's there for the longer term. So they will be opportunities within existing referral pathways, perhaps where could it be commissioned within sort of local commissioning plans, where there's an application for personal health budgets and kind of direct payments, you know, within social care. But also I know a lot of the sites are also working with their BCSE sector providers to look at the opportunity to potentially draw in additional funding or investment, so philanthropic funding or investment. So as I say, it's a key thing which I think the sites are really looking into and kind of testing at the moment. And it may be that we end up with a kind of bit of a mixed economy of funding in the future, but I don't want to kind of preempt things too much.
No, because that's part of what we're trying to find the answer to, essentially, in the different areas. That's really helpful. Thank you. Just one thing for me, VCSE, what does that stand for?
Sorry, voluntary community and social enterprise sector.
Yeah, don't worry, I thought it was something along those lines, but I wasn't really familiar with it. We each have our own jargon, don't we? It's fun. Wonderful. That's a really wonderful summary of the project. That's great. Thank you, Sam.